Hey YouTube! Hi guys! So I am back and I'm excited. Why am I excited, you ask? Because today I am 13 weeks. Yay, yay, woo, woo, go me. No, before anyway, I really am excited, you guys. I wanted to do this vlog while I was up, feeling okay and refreshed. I'm not necessarily not tired, but I'm alright. So I just came from my doctor's appointment, which was my 13-week doctor's appointment. I'm so excited. I think I was most excited about this appointment because the risk factor is kind of going down a little bit, only because I've had a miscarriage in the past. So it really just makes me feel overcome with joy to know that our little baby is doing excellent. I got to hear the heartbeat today. It was like between 164 to 160 beats per minute. So the nurse was like, well, what do you have at home? And I'm like, I have a little boy at home. She said, well, I think this one's going to be a girl. And I'm like, are you serious? She said, yes, I really do think it's going to be a girl. She was like, do you want a girl? I said, yes, I do want a girl. But, you know, whenever you want something, it's kind of like you don't necessarily get what you want. So I'm hoping for a girl. But I'm like, it's probably going to be a boy. But whatever it is, as long as it's healthy, I don't care. But she said she thinks it's going to be a girl. And she's been doing this for a while. So I'm going to hold you to that. I hope you put something in that. So yeah, so this week doctor's appointment was very, very short. It was maybe 15 minutes. The whole length of the doctor's appointment was probably 15 minutes, including doing my urine sample. So my appointment was at 10. I was out by like 10:20. So I just wanted to come back, and I think because the last time I did the video I was like 10 weeks. So I just wanted to come back and give you guys some overall symptoms that I've been having, because the last video, it was very short, which I kind of want to keep them short, but it was very short. It wasn't very interesting at all. I'm sorry, you guys. I just really wasn't in the mood, but I really wanted to get the video out there just to keep you guys updated. But I wasn't feeling it at all. I was feeling miserable. I was tired. Just the whole nine. So anyway, this time I made sure to take notes. I put them in my phone so we could actually go through all of the symptoms that I was having. And another thing, I think probably why I'm so excited to do this vlog was because this was probably the first time I've done a vlog and actually came back home from actually going out somewhere where I had to like put real clothes on instead of like my house clothes. So, oh, and I got my hair done. So, you know, they say you look good, you feel good, and the sister girl is feeling fabulous. No, really, but I am feeling good because I got my hair straightened yesterday. I got my ends clipped. I haven't had my hair straightened and my ends clipped in like a year. So, I'm going to try to keep it up, you know, with getting my hair done and keeping, or at least keeping my ends clipped, because I can pretty much do my own wrap. But yeah, so I'm just loving it. It's just so much body and so much flow. Yesterday it was on and popping, but today, I mean, it's okay. It's still got, you know, flowy or whatever. But yeah, so I like it. She did a really good job. I love her. Shouts out to you, Kiana. Go boo. Oh, she planned for her wedding too, so she was the bomb.com because she made time for me to do my hair. And I know how it is when you're planning for a wedding. It's a lot, especially on the weekends. That's all your free time. So yeah, so I said, let me get this vlog done while my hair is done. While I look pretty decent for the most part and I'm in a good mood. You know, I'm feeling good. So I said, let me just go ahead, get the vlog out the way. I'm going to get a little nap in because I do got to be to work later on this evening. So I'm going to do this. And then after I talk to you guys, I'm going to get my nap in. So, but anyway, back to what I was saying. I wanted to go over my symptoms because the last one, like I was saying, I didn't really get to go in depth with my symptoms like I wanted to. I was just tired and I just wanted to get the vlog out. So here we go. Symptoms. My first symptom that I've noticed for the past probably what week is this? 5 weeks maybe. My lips have been very chapped, and I'm not one to keep a chapped lip. I do not. It's like a pet peeve of mine. I repeat, I do not like chapped lips. I hate to have chapped lips. So it really bothered me that my lips kept being chapped. It's like I got to keep applying chapstick Carmex, Bliss Stacks, cocoa butter, coconut oil, whatever. I just put it all because I'm like, my lips were so dry. They were so chapped. I mean, and not to mention that, I guess the weather, it was cold. So with the weather changing, that definitely played a role. But I felt like I probably had more of a chapped lip because I wasn't drinking enough water. I try my best to drink a lot of water, but it's really hard. And I'm not one to not drink water. Like, I love water. I mean, 90% of the time, I'm drinking water. But I just haven't had a taste for it. Like, I just don't really want water. If I do have to drink anything, I would rather have like a juice or a smoothie or something. So I definitely was trying to incorporate a lot more water in my diet. Which brings me on to my next symptom. And I'm sorry if I keep looking down. I'm just referring back to my phone. Which was headaches. Like, I had like a headache for like 4 days straight, and I could not figure out why. Like, I was taking Tylenol and nothing was working. So, you know, my last pregnancy, after I had my son, I had to go back in the hospital for, how long was I in there? It was like a week after I had him. I was back in the hospital for high blood pressure. And, you know, my pressure was like so sky high. They had to give me all these medications to help bring it down. So I was in there for probably like 2 days. And they said that I had preeclampsia. I think I'm saying it right. I had preeclampsia, but I didn't have it the whole time during the pregnancy. I didn't get it until after I had him. But they said you can get it up into 6 weeks after giving birth, which I did not know. So instantly when I got that headache, I instantly assumed maybe my pressure is high. So I have a blood pressure cuff here at home from the last time. And I just checked my pressure, but my pressure wasn't high. So I don't think it was my pressure. But I don't know. It did seem to go away on its own. I thought maybe it could be my sinuses because I was doing a lot of sneezing and felt a little congested. So I said maybe it's that. I didn't know. I had no idea. But when I went to the doctor today, I did tell her about it. And she said that it could have been from dehydration. So I'm like, well, that makes sense because I haven't been drinking a lot of water or drinking a lot of anything for that matter. Just because the nausea, I'm just like, please, I'm just so ready for the second trimester because I'm hoping that the nausea ease up. I'm still nauseous. Like, I was not this nauseous with my son. Like, when I was pregnant with him, I think I got nauseous maybe for like a week. And I threw up once, and that was only because I was brushing my teeth. This time, it's like I'm nauseous all the time. Like, I'll be in the mood for something. I was over at my girlfriend's house Wednesday. I was over there last Wednesday because my mom had to get a small procedure done. So I went with her, and then later on that evening, I met up with my girlfriend because she said she was making dinner. So, you know, we had girl talk, whatever, and I'm sitting there, I'm eating the food, and it was so good. It was shrimp and broccoli and rice. And in the middle of eating my food, I'm like gagging. Like, I feel like I got throw up. And she was like, oh my gosh, I feel so bad. If you don't want to eat the food, you can take it with you. I said, no, I want to eat my food. I want you to think it's your food. It's not your food. I promise you it's not your food. I want to eat. I just can't eat. So it's frustrating. But yeah. So the headaches did go away. And I have been trying to drink more water just because I read online that could also be attributing to headaches. Another thing that I've been suffering with is constipation. Which is pretty normal with any pregnancy. You probably have constipation. I know I did. I did the last time and this time. But yeah, so that's another thing I'm suffering with. But I think I did talk about that the last time. I've been having pain. Not really so much. I was having it when I did my last update, but I didn't mention it. I don't know why. I just slipped my mind. But I was having a lot of pain in my lower back, like towards my butt bone. And I asked the doctor, and she said that it was just my uterus expanding and the baby pressing down on my spine. And I also was having pain in my right leg, like in my right thigh. I was having like almost like a shooting sharp pain in my right. And I was like, what is that? And she said, that's the baby pressing down on my spine as well. Which it'll happen as the baby grows older from time to time. It's pretty much gone this week. I haven't really had any issues with it. I did yesterday have a little bit of pain in my left leg, But I think that might have been just from walking in the mall, because we went to the mall on Saturday and I had to get my son some clothes because he is growing like a weed, like ridiculous. It's like he woke up one day and was in a 4T. I said, what? I just bought all these 3Ts and now you can't fit anything. So I went shopping for him. Got him some clothes. Old Navy was having a bomb sale. Like, when I say bomb, bomb. I cleaned up in there. I got like 11 shirts for $20. The bomb. And then we went to Arundel Mills, which is kind of like an outlet. So I got him 2 pairs of tennis shoes. So I definitely made out this weekend. And I even got me 2 pairs of tennis shoes. So it was definitely a win-win this weekend. Which I was glad I went, because I was like, I don't know if I really feel like going. But I went on ahead and went. And it worked out. So yeah. What else? Another symptom I have been having was my boobs. My boobs have gotten so big. Oh my goodness. I mean, I love them because I was, a part of the itty bitty titty committee. But my boobs are really, I'm loving the girls. And so was he. He loving the girls too. So, they've gotten really big, but they are sore. Like, they were aching last week. Like, oh my gosh. I mean, they didn't ache bad like, they were filled with breast milk. How you have that achy pain when that hard, when you first have a baby. Well, if you don't know, when you first have a baby and your milk comes in, your boobs be so hard they feel like rocks. But they were really achy, and my nipples were really, really tender. Like, when I would get in the shower, I had to like cover my nipples when the water beat down on them, because they was so hurt. They was hurting so bad. I was like, oh my gosh. So, but yeah, they were sore, but they don't really hurt. Like, when we're being intimate, they don't really bother me then. It's only like during the day. Like, I think it might have been the bra. I need to get some more bras, I guess, without the underwire in them, because I think that was a contributing factor. And just some more that's, I don't know what they're called. Not necessarily a nursing bra, but it's more fabric than it is like padding and all that jazz. So, one of those maternity bras, which I think I do have one, but I need to get another one. But it just makes my bras make my nipples really tender. So, yeah. So those are pretty much the symptoms that I have been having this week. Well, today I just turned 13 weeks. But last week, it pretty much was the same thing. They pretty much eased up a bit. Just the nausea was really like kicking my butt. I'm still tired. That hasn't really changed much, but hopefully within the next week or two, that'll pick back up and I won't be as tired. But I mean, y'all, when I say I love to sleep, like, I love to sleep. It's like one of my favorite things to do. Like, eating and sleeping, that's one of my favorite things to do. So you would think should be a big house. I'm sorry, I keep looking outside because I can keep seeing the car ride up and down the street. But yeah, so my next appointment is going to be April 15th. That she said that appointment they'll do a full anatomy ultrasound, where they do like the measurements of the arms and the legs and the head and everything like that. And she said that's going to take about 30 minutes. And then she said after that appointment, or after the ultrasound that same day, we'll just have our regular doctor's appointment. And I'm super excited because that day we get to find out what we're having. Well, I'm not going to find out what we're having. I don't know if he's going to find out what we're having, but we're going to tell them to put it in an envelope. But that appointment will be able to get the sex or the gender. So for the gender reveal party, we can go ahead and pass that along, get the party planned, and then at the party, voila, baby, boy, or girl, either one. So yeah, so I'm excited. This appointment was so exciting for me. I don't know why, I was just like super excited. I think just because I know I was at that mark where everything is like, okay, your chances of miscarriaging is really lowering. So it just made me so happy to hear that heartbeat. I was like, oh. And then when you're so early, you can't really feel anything. So it's kind of like some days you feel like you're pregnant, some days you're not. Or you don't. So, yes, I was just pumped up today. But, yeah, so that's pretty much it, you guys. I don't want to hold you up. But if you have any questions, definitely feel free to ask me. Comment below. And like and subscribe. Please don't forget that. I hope you guys continue to follow my channel. I'm loving you guys. Thanks for all the love and the views. I don't have that many subscribers yet, but I still have faith in you guys. So I'm going to go ahead and do my belly shot, and then we're going to go ahead and see you next week. All right, you guys. So this is my belly, 13 weeks with my shirt on. It's starting to poke just a tad. And then this is with my shirt up. I've been having a little, I guess, round ligament pain down there too. But it's definitely growing. I can definitely see it growing. My boyfriend's like, "Oh, you poking. You got a belly now." So that's my belly. I hope you guys enjoyed my video, and I'll see you guys in a few weeks on the next video. Thanks for watching, guys. Bye.